We get these blood panels done, and I can't tell you how many people come to me and say, Sara, especially in the last year, I've gained weight. I don't know where it's come from. My doctor says my thyroid's fine. And I just did a round of buying blood tests for me, my 2 daughters, my son, and I did them a couple months ago for my husband. And when you go in to buy these tests, it's on the full panel, the full, most comprehensive panel that you're paying $400+ They only test TSH. They're not even giving you all of the thyroid hormones to test in the full panel that you're paying so much money for. And so you're getting this feeling like, well, this is my total health picture, but the thyroid's the master endocrine gland, affects everything else. So really, it's not. You got to look at everything. So I want to first, let's go through all of the hormones, and the ones that mean the most, the ones that could be the hidden ones that are hurting us and we don't even understand why. And then how they affect all of our other hormones like insulin, our liver enzymes, our progesterone, estrogen, and testosterone. Everything's related. So there we go. I'm going to start with the thyroid hormones.
Yeah. We need like a big whiteboard, right? Because there's so many correlations that we can make with each hormone and how they tie and affect each other. But let's start with thyroid. Honestly, I'm about ready to revamp my optimal lab range sheet, because on there, I think a lot of people get confused because I do have free T4 on there and I have TSH. Now, TSH, you're going to get that tested every single time. We want it below a 2. But a lot of people still ask me, and I mean, you know this, Sara, it doesn't matter how many times you say something, there's somebody new listening every day. So I get this question ongoing. My doctor's freaking out over my low TSH. She wants to pull back on my thyroid medication, reduce my T3, reduce my armor. And, that's just a lack of understanding of how the thyroid gland actually works and signals in the body. Whenever you're on any kind of T3, that TSH can go down. So I have come to the point where once I start working with someone and treating them, almost don't even test TSH anymore. That way nobody sees it, nobody freaks out, don't care. Then we move on to free T4, which...
Well, before you move on,
a
high TSH that's out of range, I get this a lot, is from too much iodine. I say too much iodine because I don't believe that you can really get too much of the right iodine, the acceleradine iodine, but temporarily it will make the TSH go high because there are thyroid hormone receptor sites on every cell in the body. So all of a sudden the iodine wakes up the thyroid and the pituitary says, hey, wait a second, we need iodine for every cell, not just the thyroid. Let's wake it up, make sure we are saturated, and then it will come back down. And we're going to show a blood test in a minute that is the case.
Okay. Yeah. And I mean, if you're not on iodine, your TSH is high, you have hypothyroidism. If you are on iodine and your TSH is high, that's when the other markers become so vital. You have to move on and look at where those other markers are. And I'm going to really break it down simply for you. The only 2 that you absolutely must get every time and must look at every time is the free T3 and the reverse T3. In fact, I don't even care if you get your antibodies tested every time. Listen, if we know you have Hashimoto's, we know you have Hashimoto's. Now, if you were coming up with a 0 in Hashimoto's, go ahead and retest those antibodies because those can come back as false negatives quite often. But the main 2 thyroid hormone tests, free T3, reverse T3. If those 2 are off, it doesn't matter what the rest is doing. Now, the rest, I look at free T4 because quite honestly, if free T4 is high or even higher in the normal standard lab value range, and I can't even tell you how many times this has happened. I'll be going through someone's labs and I'll see that high free T4 and I go, I bet this person has a high reverse T3. And then I scroll, boom, there it is, reverse T3 of a 19. Because when a person is on too much T4, that is a huge pusher to reverse T3. And most of us don't convert well. I know we're going to talk more deeply about reverse T3, but there's so many issues that come into play with conversion. Most of us don't convert well. So what do conventional doctors do? Just give more T4, more T4, more T4. So if you're out there and you've been on Levo or Synthroid and you've been changed from 50 micrograms to 75 micrograms to 88 micrograms to 112 micrograms to 125 micrograms, because you keep going in saying that you don't feel better, so your doctor keeps giving you T4, but they're not testing your reverse T3, they could be doing you a disservice. And guess what? That's probably why you feel worse. So free T3, reverse T3 are the two most important thyroid hormones that we can test. And then I want to take a pause and let you speak because I've been speaking a lot. And then we can go into the other hormones.
Real quick with T4, say you're increasing, and you do have a conversion problem, but maybe you're able to get a little more free T3 every time you increase and more reverse T3. So they're both increasing as you increase T4. Do you see that? Or do you typically see the free T3 is not changing and just reverse T3 is going up?
Yeah, it depends on the person. And I'm so glad you asked that, because this is the perfect example of why the thyroid gland is nuanced. So there's a variety of, just like you said, different scenarios that we can see. And my God, I've looked at so many sets of labs, so sets of thyroid labs. I can give you all of them. So there is one scenario where, let's say, conventional doctors giving more T4, and we test and we see that, okay, free T3 went from a 2.4 and now it's a 3.2 or a 3.5 or even a 3.7. And you look and you go, okay, well, this is okay. But what's the reverse T3? And then you go over to the reverse and you see that it's, an 18, 19, 22. What that picture is there's so much reverse T3 in the body. Now, remember, reverse T3 is the anti-thyroid hormone. So, Sara, you talked about bromine and fluoride competing at the receptor site for iodine. Think of this kind of the same way. Reverse T3 is competing at the receptor site for free T3. If you have too much reverse T3, it is blocking you at the cell receptor site from that T3 hormone attaching and turning that lock and key mechanism to turn on that cell, to give you a metabolism, to grow your hair, to light up your brain, whatever it is. So oftentimes we can see almost too much T3, or a really pretty, like a really optimal, where you would go, all right, this person must be feeling great, until you go over here and look at their reverse T3. And then you go, no, they're not feeling great because their body's in survival mode, because none of that T3 that is being picked up in the blood. Yes, it's in the blood. It is in the blood. And that's why when we do that serum test, we're getting a really nice number, but it's not getting to the cell. Reverse is way too high, blocking it. Now, you also might have a scenario where somebody has a very low free T3 and elevated reverse T3. And that conversion is just, the conversion isn't happening. None of the T4 is going to T3. It's all going to reverse T3. And now you have the low free T3, elevated reverse T3 scenario where the person is walking around in survival mode. And that's the key part of this. If you're having kind of a hard time, because we're getting a little bit sciencey here, a little bit geeky, just remember, reverse T3 puts your body in survival mode. So you will hear from your conventional doctor, well, we only test that in a clinical setting. Meaning, if you're laying there in the ICU or the ER fighting for your life, guess what? Your reverse T3 is going to be high, because our bodies are so brilliant that our bodies know that you don't have to burn fat, feel good, make any major decisions, grow your hair, or even poop when you're laying there fighting for your life. Here's the problem. If you're not in the hospital and you're walking around trying to do this life that we're in, raise 3 kids, be a businesswoman, go to work, clean the house, order some groceries from Instacart. I know, tough job, right? But still, we want to be functioning at a high functioning level every day. If our body's in survival mode, we're not going to be able to do that.